It's the night before Dr. Bobby McCullough leaves his Flint, Michigan home and heads to the Mayo Clinic in Minnesota. His mood is calm, even jovial at times. The doctor, turned patient, is choosing hope over fear.
I can genuinely say there's not fear in my mind.
But there is concern, mostly for the people he loves most.
If something should happen and I'm not able to manage life and help my family manage the things that I've been responsible for, what that's going to be like for them.
2024 was a year of incredible joy for the Flint physician and his family.
Medicine is what allowed my parents to come to Flint, Michigan back in the early 1970s. So it's just a nice way to give back to the profession that has given us so much.
In June, he made history when he became president-elect of the American Medical Association. He says it was the first time he'd ever seen his dad cry.
Having come here as an immigrant physician at the age of 25 and within a generation have his child be the first president of the American Medical Association of Indian origin was something that brought tears to his eyes. And so tears of joy at that moment.
Less than 6 months from that moment, Dr. Bobby would watch his dad weep for the second time.
But no longer tears of joy, but tears of despair when he, as a radiologist, knows exactly what he's looking at. You know, and I sent him the pictures from my phone. And he had to take a moment. He said, okay, I'll call you back. Let me just think about this for a second. Because he saw that it was a tumor, and then he saw the name on that scan, and it was his son's name.
The MRI image identifying the source of some recent cognitive episodes that he was experiencing.
And as I look back on over the course of the past year, maybe a little bit more, about things that have happened that I didn't attribute to anything serious, and now when you put it together, it makes sense.
Moments of forgetfulness.
For maybe a minute, 90 seconds, just losing track of the words and sort of having to babble a little bit to sort of get back to my point, and then being able to resume the conversation. Never more than a minute or two. And I thought, as those things were happening to me, a few times over the course of the past year, I thought that was a senior moment.
It wasn't until he was giving a speech in front of a room of doctors at the AMA that others became concerned.
All of whom have known me for years and have heard me give speeches and knew that wasn't the typical Bobby McCullough speech that they're used to hearing. And everyone thought I was having a stroke.
So once you realized it wasn't a stroke, did your mind take you anywhere? You are a physician.
Yeah. So I thought, okay, I'm going to get an MRI scan. Maybe there's something called a TIA, a transient ischemic attack, which is like a mini stroke is what a lot of people would call that, where the MRI wouldn't necessarily show anything. There's not going to be a part of the brain that isn't getting blood flow that has a stroke, but just a transient sort of ischemia. Ischemia means low blood flow, and that sort of makes it seem like stroke symptoms, but within 24 hours everything's back to normal.
Dr. Bobby had the MRI. It was not a TIA. The image on the scan that caused his dad to cry revealed an 8-centimeter tumor, a glioma, grade 2.
And so technically speaking, this is in the cancer diagnosis list, right? So it is a type of cancer that, not the kind of thing that you really have to worry about spreading anywhere, but something that can spread locally, right? It's not a benign tumor where if you get around it, you get it out and you're good to go, like a lipoma or something like that. This is a relatively large tumor in the back to front dimension, so it starts up here, but it goes quite a ways back to the back of the brain. And it's a tricky area because the outside part, the lateral surface of the temporal lobe, is the language center of the brain. And because I'm right-handed, I'm left brain dominant, which means that the speech center, my ability to speak and have this conversation, is very dependent on that portion of my brain. And so the surgeon has to go through that portion of the brain to get deeper, which is where the tumor is, to start removing that.
A surgery that he will be awake for and could take up to 12 hours.
Right, so while I'm awake,
In real time?
In real time, yep. They're dissecting through that brain tissue to get to the tumor and then start removing the tumor, but the whole time awake so they can ask me questions to make sure that they're not in a critical part of my brain that's affecting my ability to speak.
Only time will determine how life will change for him on the other side of the procedure. But in the days and hours leading up to it, Dr. Bobby is being fueled by love.
If I sort of look through my text messages for the word love to see how many times it's appeared, in my entire history of having a cell phone, it's never appeared more than it has in this past 3 weeks. right? People expressing that, me expressing that back. And it's just something that there's a social awkwardness to using that word until you have a moment like this that I don't think is reasonable, right? That I think that that's something that, how awesome would it be to be able to express that and receive the expression of love without having to have a brain tumor.
The tumor has made him realize how short life is, and to make sure he never forgets, he keeps a daily journal.
You know, it's odd, and I don't know if it's, again, my stage of life, but I tend to wake up between 3 and 4 in the morning every day nowadays, even before the tumor. And maybe that's being on the other side of 50 that happens. And oddly, there's a moment of clarity in those hours when there's nothing else going on, where things occur to me. And I started to get in the habit of writing some of those things, particularly as it relates to tumor. So I call it, you know, tumor wisdom or tumor reflections. And some of the stuff we've talked about, like don't wait to show affection to people until you have a moment like this, right? Show that affection before.
You know, you're smiling, you're able to find some humor in this dark moment. How are you able to do that?
I think part of it for sure is having a plan, you know, having a diagnosis in a very timely fashion. You know, if I lived a couple miles north of here, you know, we're in the city of Flint, but if I was in a different part of the city of Flint, not a physician, you know, not in my level of the socioeconomic spectrum, that I would still be waiting for prior authorization for an MRI scan, still be waiting to get one neurosurgical opinion from a neurosurgeon, let alone 5 neurosurgical opinions from the top 5 surgeons in the country that do only this type of brain tumor, right? That spectrum of the level of care, from being cutting edge, best access to care in the world, to struggling and being almost third world in access, is something that I'm privileged to have. Right? And so how can I not be extremely happy and content that my family and I are reassured of that level of care, but at the same time sort of have the responsibility as president-elect of the American Medical Association to try to close that gap. Right? And that's what I hope to do on the other side of this, is speak about this as we're speaking, to say, you know, this is the access I had. And not everything is going perfectly well. There are still issues with the system, but trying to bridge that gap and close that gap so more people have this level of access would be another sort of silver lining on this cloud of this brain tumor.